Good evening, everyone. Gareth Presch, founder of the World Health Innovation Summit, and I'm delighted to welcome you to this evening's discussion. It's part of our 16 Days of Activism, and this evening we are talking about women in healthcare, gender-based discrimination, and workplace harassment. And I'm delighted to welcome our panel this evening, Keira, Isabelle, and Dr. Neela Shabde. Let's start with a round of introductions. Keira, you're currently in Cork, in Ireland. Delighted to welcome you to the session this evening. And please give our audience a short introduction.
Hi everyone, my name is Keira Lonergan. I am a critical care nurse manager in an acute hospital in Cork City in Ireland. I joined the WHIS group recently for gender equality and women's empowerment, and we're just helping to work towards a more sustainable and equitable future. I recently completed my master's in intensive care nursing and education at University College Cork also. And I'm absolutely honoured to be included in this discussion today.
Thanks, Keira. Isabelle from Geneva, delighted you can join us this evening.
Thank you, Gareth. I am so happy to be with you during this session. I am Isabelle WACHSMUTH and I am working from the World Health Organization. I am based in Geneva, Switzerland. And I have been able to start a new initiative, innovative initiative in WHO. It is called Art Impact for Health. And previously, I have been able to do another program about evidence-informed policy making. And I am an expert in public health, and my background it is in biology, physiology, and specialty in homeostasis, and I believe in to bridge art and science, and specifically art and healthcare, because I am as well an artist. And it is important to combine, I think, different disciplines together and different talents. Thank you.
Thanks, Isabelle. And let's go to Neela, who's joining us from Newcastle in the UK. Hi, Neela.
Hello, Gareth. Thank you. Thank you for inviting me. I'm really honoured to be on the part of on this panel. Thank you. My name is Neela Shabde. I'm a retired consultant pediatrician, and I've worked in the NHS for about 40 years. So it's a long time. So I'm delighted to share some of my experiences and some pragmatic approaches, how we address and cope with the gender-based discrimination, harassment, bullying, call it whatever, at workplace. Thank you.
Absolutely. Well, if we start with Isabelle, and Isabelle, perhaps you could give us some high-level statistics around types of discrimination and how, shall we say, women in healthcare, even in the workplace. If you've got some high-level statistics, that would be fantastic to get us off the mark.
Yes, absolutely. First, I will give you some high level of statistics from the different UN agencies, just to have an overview to start our discussion. First, from my organization, World Health Organization, according to global estimates, 35% of women, or nearly 1 in 3 women, report having been exposed to physical, psychological, or sexual violence by an intimate partner or someone else in their lifetime. It's quite huge statistics in a worldwide level. From the United Nations Office on Drugs and Crime, all of the women who were victims of homicide worldwide in 2012, nearly half were killed by an intimate partner or family member, compared to less than 6% of the men killed in the same year. Another key fact, it is from UNICEF, worldwide nearly 750 million women and girls alive today were married before the age of 18. Child marriage often results in early pregnancy, and social isolation interrupts schooling, limits girls' opportunities, and increases our vulnerability to domestic violence. From the World Health Organization and UNICEF, at least 200 million girls and women alive today have undergone female genital mutilation in 30 countries in Africa, the Middle East and Asia, where the practice is concentrated. Female genital mutilation is a violation of the right of girls and women. Another important key fact, it is as well from United Nations about the women and girls account for 71% of victims of human trafficking worldwide. Nearly 3 out of every 4 women and girls trafficked are trafficked for sexual exploitation. And another important fact from UNESCO, an estimate of 246 million girls and boys experience violence in schools each year. Gender-based violence in schools is a major obstacle to universal access to schooling and the implementation of girls' right to education. And 82% of women parliamentarians who participate in a study conducted by the Interparliamentary Union reported experiencing some form of psychological violence during their mandate and cited social media as the main channel for disseminating such violence. Another key fact related to the prison environment, more than 500,000 girls and women are detained in penal institutions around the world. Although they constitute a minority population, there has been a significant increase in the imprisonment of women in recent years. In 15 years, the number of women and girls in prison has increased by 15%. And from UNICEF, 25 million child marriage have been prevented. That it is about the progress, have been done related to some key facts I have explained. And 25 million child marriage have been prevented in the last decades. The proportion of women who were married during their childhood declined by 50% from about 1 in 4 to about 1 in 5 women. And to finish, just to tell you another good news, rate of female genital mutilation among girls aged 15 to 19 in the 30 countries where the practice is concentrated increased from 1 in 2 girls in 2000 to 1 in 3 girls in 2017. Donc we have some key fact about as well good news.
That is something that be welcomed, but I mean some of those statistics, and thank you very much for effectively setting the scene for us from a global perspective. And I wanted to ask Neela, because Neela's worked in this for many years, and just before we came on was actually talking about that it's not just third world or emerging nations that we have these problems. Some of the statistics there, even from the parliamentarian members of society, over 80% of women, they're quite startling statistics, Neela. I suppose there is many types of discrimination which we've mentioned, from be it disability, race, sex, age, origin, color, religion, and so on and so forth. From your experience and from Isabelle giving us an oversight, Why do you think that we have this problem?
Oh, I think it's human behavior, and it's about control, and it's been there for, I think, decades, if not longer than that. So I think it's carried on, and it then shows up not only just in the home situation, but also in workplace. If that is not checked and if that is not addressed, I think women can be victims of that. And also, I think we should not forget that there are a small percentage of men also are subject to discrimination and violence and all that. We do know that the domestic abuse, although primarily women are involved in that, but we do know that the men are also involved in that. So I'm talking across the board, really, that the victims of any kind of harassment, bullying, I think financial abuse, emotional abuse, and to the end of the spectrum, the kind of violence that results in death. We do know that in UK, 1 to 2 women die every week at the hands of their partners, and it's usually somebody they know, and that is really the seriousness of abuse that we see. And it is heartbreaking because that impacts on, obviously, children as well. And having worked in the field of safeguarding, I saw that quite regularly. I no longer do clinical work, but that leaves an impact on you. And I think you asked me the question, why is that? I think there are multiple factors, and why some of these behaviors carry on in workplace. And I'm interested in the kind of gender-based discrimination, bullying, harassment, and I can talk about NHS, but I'm sure that other, I think, organizations are not immune to that, and that carries on at all levels in different organizations as well. And I think there are lots of studies that I kind of looked up, and we know that about 20% of in one study they said 20% of victims suffered that kind of abuse, but even larger percentage, 40 something, and I can give you the kind of links to some of these studies. I mean, the literature is absolutely huge. They actually witnessed their colleagues being bullied. So I think the responsibility is really on everyone to see what's happening and how we can empower women in this particular situation to be able to stand up to that, being aware of what's going on and how to receive help, but also how they can empower themselves to kind of address this issue so that this behavior doesn't continue. Particularly, sorry, you're asking.
No, I was going to say absolutely, and it's such an important point when we look at, from the healthcare's perspective.
Yeah.
I was going to talk about, it's the year of the nurse and the midwife, for example, across the spectrum. And I think the statistics in healthcare, for example, is over 70% are females, within the health sector. So this sort of discrimination and these sort of statistics that we're talking about has such a wider impact on our society in terms of discrimination. So, one of the beauty about these 16 days of activism has been the fact that we've been able to talk about these, get these things out there into the open, because that's the first way of actually being able to solve some of those statistics. But please do continue about your experience, and then we'll ask Keira as well for some of her insights.
So I think it was interesting. I mean, I first started my career, in 1979, and went for a locum because you couldn't get jobs in pediatrics, and I was told, don't bother about pediatrics because you won't get it. Yeah, I didn't see it as kind of discrimination or racism or you name it. I just looked at it, right, I want to get into pediatrics, and no matter what, I'm going to get into pediatrics. And I think the first interview question was quite interesting. Why have you given up 4 years of your life when you kind of came to England and you haven't worked for 4 years? I mean, these days, these questions won't be allowed in the interview panel, So I said, well, I needed to look after my child before I could look after other people's sick children. And I think that was quite impromptu. The answer came to me. I answered that. There was a tough competition, but I was very pleased that I got the job. And then I worked with the guy who might have had, interesting approaches and attitude towards not only just people coming from abroad, but women in particularly. And we were able to kind of, settle those differences. And I was delighted that, I was able to do that. And then I asked myself, my first job here as a trainee, how did I kind of address that? A lot comes from your childhood when you observed, your parents dealing with it. You observed, your other kind of mentors dealing with it. And that is very important, how we empower children. And I think it has to start from the school playground, when boys are playing with girls and there are people watching them, how they are treating each other. And if we get that right, so there are a number of approaches we can adopt, but it needs to start from very early on.
Very early.
And I was just going to say a couple more things, that when I became a consultant, there were, I think, experiences that I wouldn't want to go into great details, but there were challenges. And something that really helped me, that we had the training, education, development for women doctors in the Northeast, in the deanery. Somebody championed that we need to empower women. And that training really, really was helpful. And I had fantastic mentors and coaches. One particularly who I could talk to, and because he was a senior kind of clinician and had dealt with a number of these things, his knowledge, his experience helped me. I think we need to be open to say what's going on rather than, shut down. And that often happens. So I made it a point with my trainees that, I kind of proactively asked them what was happening. Because part-time working was another issue that my colleagues would say, oh, she's just a part-timer. I said, excuse me, what do you mean by that? She's got her commitments at home. And in fact, once I said, you wouldn't have had children if your wife wasn't allowed to work part-time. And after that, he changed his attitude completely, So I think it is being empowered, being aware, having information. And we now have policies, but policies are as good as the people who follow them, who know about them, and who are willing to implement. So we have legislation and great stuff. And NHS has kind of got the legislation against all these issues we are talking about. But we need to be aware of that. We need to know who to go to, and we need to change the culture. Organizational culture and leadership are key to root out, the
yes, absolutely. And I was going to come to Keira. Keira, from your perspective, this is something I think that's culturally a challenge for the health service to really get involved in. And I think if you look at the recruitment and retention rates within the service, it's a big kind of it basically shines a light on some of the challenges that we have in terms of retaining and recruiting staff into the service, and particularly the high turnover rate. Do you have, from your experience, some examples, or have you witnessed this, or how do you think we tackle this going forward? Because I think what we want to try and do is look at how do we become solution focused, and how do we encourage the next generation to get involved, and how do we take away those barriers that Neela's just described?
Yeah, definitely. Just to bring the statistics closely to gender-based harassment and discrimination in the workplace, nearly 50% of medical students experience gender harassment before they even start their careers as physicians. And to bring it close to nursing, as you were saying, you're the nurse, over a fourth of nurses have experienced sexual harassment. Over a third have been physically assaulted in the workplace, and almost 2/3 have experienced verbal abuse. So you can tell by that it's very stark. And particularly, as you said, Gareth, there is a shortage of healthcare staff. I think you might have said before, was it around 18 million, and maybe around 9 million nurses?
Yeah.
And it is showing that, when people are under stress at work, you have stress-related illnesses, increased absenteeism, and high staff turnover, and that's not really where we want to go with our staff numbers. In regards to solutions, I suppose I think having good role models is really key, as Neela said. Also, I really liked the UN had a campaign, He for She, and I think having men as allies in this cause is really, really important. I think, correct me if I'm wrong, or I don't know your opinions on this, everyone here, but I think the people that are I suppose maybe involved in the verbal abuse, they don't, may not respect the people that they're actually harming with their words. I feel like their colleagues are people who they respect, and perhaps maybe, someone stepping in that regard, if they see verbal abuse and they look, that's not okay. Because there is a bit of a stigma, for not a lot of people will come forward whenever they experience abuse. Because first of all, the stigma, as I was about to say, in regards to, that person's causing trouble, unnecessarily. Really get rid of that attitude in regards to addressing this. And also, I feel like we need to empower women to, be able to, you can address the person initially, as Neela did, so tactfully in her instances, but also ways about, you can go to HR and things like that to get support, or to the manager. But yeah.
It's one of those things, and I think if you start this process of going down the HR route, and that it generally doesn't end well, for the person who makes that complaint. And this is just, from experience, and I think this comes down to values and culture within an organization. And the sad reality is that normally the person being victimized is usually the one that loses out over the long term. And this is a fundamental problem. I think even when you look at, if we just talk about even whistleblowing, from the point of view of someone who is actually trying to improve the service, is actually discriminated against because they raise a concern. So for me, that needs to change. That needs to be changed. And then the value. And if I just ask Isabelle, Isabelle's looking at a new approach, and more so of looking at how can we embrace positive change through the arts. And perhaps some of the work that you're engaged in through the arts can allow staff a new way of expressing themselves, which actually relieves that stress and pressure. And I suppose it's getting to a stage where people understand and treat people with respect. As Keira mentioned, when people are having verbals with someone, it might be a case that they're at they may see them as at a lower pay scale, or wherever it may be, that they feel they can actually, treat someone that way, which we have to just stop. I think we have to address that head on. Perhaps you could give us an insight from the arts perspective how that could potentially be a solution, Isabelle?
Yes, with pleasure. And thank you, Gareth, for this introduction. In fact, we have been able to do a beautiful art exhibition with United Nations and with France, in fact, as a country, to support this exhibit about how to go from violence to resilience. And through the perspective of women. And this art exhibit was very powerful. Why? Because we have decided to use 7 key emotions, every human being, in fact, will go through. Because as you know, sometimes emotions are not expressed, and specifically you cannot process, or you cannot understand what is going on. And go to resilience process if you don't express this emotion. So it was very beautiful to see, and we have worked with psychological people, specialists, to know, for example, what have been the key pathway of specifically of women in this situation of violence, and you have some key process in the emotion, from for example, from this feeling of disempowerment, or for example, when you don't exist anymore. For example, when your identity disappears because you have no self-esteem. what happens, in fact, in general, you isolate yourself. Donc you have not the occasion to contact people or to express yourself. You are more and more isolated. And when you are isolated, in fact, you are like in some vicious circle and you cannot go out, and that can lead to depression, even in suicide sometimes. And look, in this process, sometimes in terms of emotion, you need to have a phase of like the anger process, I will say, because it's very important to be able to speak, to have a voice, and that it is very difficult step in this process. But after you are able to express this anger or this frustration or this disempowerment, you can go to the resilience pathway, specifically through the process of hope, joy, and again freedom. But freedom, it is inside. It is not really outside. And specifically, you can when you are working with any people around of you have been unfortunately in front of this type of abuse. We can see so many common similarity. The process is very, I will say, common in many people. And for example, for us, art and culture are absolutely critical because it is a way and soft way, in fact, to engage people in this resilience, pathway. And for example, for what we have done so far with art, we have discovered art is a vector to increase the vitality of the community and break the difficulty of expression, with different, people around of you. And it is a vector to increase as well civic mobilization, donc to engage all the stakeholders and to improve understanding of, for example, this type of huge issue, to propose a reflection on oneself and on the community in the same time, to take a new look at the status quo, because the idea of art, it is where we are, what it is common in what it is our universal language, what it is the emotional pathway, and that help a lot to go to the resilience process.
And if we go to Neela, and I wanted to kind of put that into context, what Isabelle has described in terms of resilience and empathy, and most people who are brought into the health sector have those skill sets in abundance. But the problem is when we get into this position where our resilience or we become stressed, unfortunately in the workspace that we're in, if we have workplace harassment or if we're feeling intimidated, because ultimately that's what comes, mistakes are made and patients unfortunately are harmed. Because that's the repercussions of the workspace that we're in, because it's a very complex, critical area that is dealing under immense pressure and stress. So that professionalism needs to be looked at. How, from your experience, and Keira mentioned role models, and how do we effectively turn this ship around? Or provide that support? How do you think we solve that?
Yeah, no, thank you. I think it is a continuous process. Just because one organization has implemented certain recommendations or certain ways of dealing with it, you cannot become complacent. You got to keep reviewing that. And I think something. I think it was 2015 or before that. I think race equality standard was brought into NHS. What it means that every trust has to report on those 9 standards. So it asks about what percentage of maybe ethnic minority population within your or staff within your organization experience harassment or bullying, etc., compared to their white counterparts, or about disability. So all different kinds of issues of discrimination. And I think that has probably opened up, some people's eyes about, what's going on. Because quite often, as you said, because of stress, people are not really thinking. Their vision becomes very tunnel, very narrow, and they can't see beyond that. So I think we need to kind of make sure that the leadership at the top, so the chief exec, the board, the trust boards or any organization board, absolutely kind of believes in these values and actually lives by them. And leadership, I think, is key to changing organizational climate and culture, but also individuals on the ground, because if 40% of people actually watched what was going on, they don't want to get involved in case, they face the consequences of, blowing the whistle or whatever. So I think education is extremely important, that and it happens at all levels. And leadership is about your behavior, every, I think, employees and employers' behavior in terms of how they address some of these things. And I think making it possible to be able to talk to individuals about those things through different kind of channels. So it is something challenging, but I think it can be addressed. I do feel coaching and mentoring is another way. I think now each organization, when they appoint new consultants, I'm talking from medical perspective, but I think it should be for nurses, managers as well. So they are given a mentor or a coach, but they need to be properly trained. If you're not, I think any coach is as good as, the advice and support you're going to be able to give. So the proof of is in meeting. Yeah. So there are lots of different things. Yeah.
I totally agree. And I was going to ask Keira, for the future and you mentioned role models. I've been very fortunate in my career within the health service to have some, exceptional role models, people to look up to, people to help. Do you think that the health service is equipped? Does it have what it's necessary? Because if you see with COVID, we're going through dramatic changes, digital, I heard, previously, I think it took 17 years for a change to be made in the health service. That's the time frame for something to actually change, which is just, a phenomenal amount of time, where I think in the banking sector, culture changes over maybe 7 years. And, so is the health service equipped and ready for the next, 5 to 10 years?
Yeah, I think that there is a bit of a change happening already. A lot of the people coming up through the system are already showing, like courteous behaviors and more self-awareness of how to manage themselves and how to react to situations. So there is a kind of a positive light of hope, if you want to say it like that. I think that, the health service has a lot going for it. They are employing more, or I suppose using, digital purposes in regards to education for, like in COVID, we had a lot of, like all of a sudden the education was at the tip of your fingers. It was amazing. So I think just in the regard of, education for prevention, it's kind of a common thread through all our talks the last 16 days, that really prevention is better than the cure. We know this from healthcare as well. And really it's just actively living it and making it, part of, I know Neela said part of policy, but also, for our leaders and role models to actually live this. And through that, I think that's what will get change, or sustainable change, hopefully.
Absolutely, and we want to be able to support people in these situations through understanding. I'll do a quick round to everyone and ask just for some final thoughts in terms of women in healthcare, gender-based discrimination, and workplace harassment. If I go to Neela, just back to Neela, if you could perhaps just tell us a bit of wisdom for everyone tuning in here, a bit of advice for those stepping into the health sector. What would be your advice to those people listening?
Yeah, no, thank you. I think before that, can I just say that there are some excellent trusts and organizations where they've addressed this issue, and they have, overcome some of these difficulties, and as a result, the staff satisfaction and experience actually increases. So I don't want to kind of say that it's rife in every organization. I think a lot of the top leaders within who are chief execs, they have addressed it. But there is still a lot more work to do, and we can't become complacent. So going back to your question, I think is to be well trained in other aspects of healthcare setting and being aware of what's happening. And I think these days, there is this mandatory training also addresses bullying and harassment and other things. So not to kind of skip that, but really do that training and make sure that you have a support system, your own personal system, but also within the organization that you can talk to, and how to communicate that in a way that doesn't just point fingers at people, but actually find a solution to moving on. And I do believe that the NHS values are, care, compassion, kindness, and that needs to reflect in the organization. And if everyone kind of is educated on those, principles and values, I think we will see a better workplace. And being an optimist, I'm going to say that, there is always a possibility.
Absolutely. And Isabelle, from your perspective, words of wisdom, final thoughts, in terms of workplace harassment, discrimination, anyone out there that's listening to this that needs some support or helps or some advice, what would you say to them?
Yeah, for me, related to the power of art expression, and specifically in the case of when you face violence, I think it's very important to support and encourage, every at country level, every institution, specifically of course school, but as well any hospital, environment. If they can, if they have already existing art program, and many of countries, they have amazing, art programs support really the patient, and it is very beautiful to see that, because it is a way to consider, the wholeness of an individual, of someone, and I think it's very important to consider, all the aspects of each individual. It's not just about the treatment. It is about before any issue, if we can prevent, and we can prevent a lot, because when the trauma is here, it's that damaging not just one individual but all the generation after that. Because we know in epigenetic, for example, each trauma will be transmitted, to the next generation. So it's very important to consider not just, I will say biomedical science, but to consider as well social science, and specifically through this very powerful art program in healthcare setting, for example.
I absolutely agree, and thank you very much for that insight in terms of looking forward, in terms of what we can look to the future. Keira, final words from yourself, in terms of advice to people listening in, women who are in healthcare settings at the moment who may feel that they've had discrimination or workplace harassment. What would your words of wisdom be? Oh, sorry, you're on. I think you're on mute. There you go.
Oh yeah, just following there. Thanks. Really, I just that's really what Neela and Isabelle said, and also just I think having more women possibly in the leadership role might kind of help change the culture that's out there, and also empowering women to do these situations as best they can and to get the support where they can. And there is support out there, as Neela had mentioned. I'll just leave you with gender-based violence is related to gender roles, power relationships, and particularly discrimination against women. And in order to address violence, we also need to address the societal and relational context in which violence occurs. And I think that's very apt for this conversation.
Absolutely. And listen, I just want to thank everyone who's tuned in this evening. Just to say, just final notes is really, you know, it's a common theme throughout these talks has been education. And also, if you do need support, just find someone to talk to, a friend, a colleague, as Neela's mentioned, Keira mentioned mentors, and Isabelle. You know, reach out to people and take advice, and don't be afraid to ask for help as well. This is our second last talk. We've one more talk on the 10th, which is around UN SDGs as a vehicle for addressing gender-based violence. You can join us on Thursday from 7. And that's the final session of our 16 Days of Activism. We just want to thank our panel again, Neela, Keira, and Isabelle, for joining us this evening. And thank you for tuning in. We'll end this broadcast and just wanted to say thanks to everyone and have a nice evening. So, bye, everyone.